health care.
Could I return for a minute to the question you started off with about dimensions of disparities?
Yes.
And this really fits in a lot of what we've been discussing. We think that if people have health insurance, they must have access, they can pay for it. But I think a lot of times for the working poor, or for people who work, who may not be poor, but work for employers, the increasing number of employers who don't provide health insurance, we need to really understand what health insurance in our system provides. There are really three functions of health insurance. The one that seems obvious is the redistribution of risk. So the healthy this year will help to pay for the sick this year, and next year when the healthy gets sick and they reverse places, it spreads the risk, so it makes it possible to afford it. Everybody understands that insurance role. The second role of insurance is that it allows people who have jobs and to actually use money, pre-tax dollars, to pay for their health care. That means that the very wealthy people who pay larger amount of income taxes and pay maybe the maximum payroll taxes, that's both Medicare and the Social Security taxes, are actually buying their health care with dollars that haven't been subject to those taxes. Whereas if you don't have health insurance through your employer and you're paying out of pocket, you've already paid income taxes and payroll taxes on those dollars, and then you pay for the doctor. But the third reason, the third function of insurance, which is which many of your viewers may not know, is that insurance companies increasingly are important for those of us fortunate enough to have private insurance because they negotiate prices for us. What's not often known is that poor people who don't have insurance are actually, they're charged just as our insurance companies are, but those charges are on average 2.5 times more than what people who have a Blue Cross pay for them. And many poor people actually do feel that a bill is something to be paid, and they will work, they'll mortgage their futures to pay those off.
Well, as you can see, we could spend hours and hours and weeks talking about this subject. Before we end today, I would like for our audience to know that United Way cares about your health. Community Health Services is just one of the United Way agencies that can assist families and individuals in receiving the health care that they are entitled to. Please call 211, United Way's information and referral line, and an information and referral specialist will connect you to additional United Way agencies that can serve you best. And to our guest, thank you for taking the time to share your thoughts and your expertise in our very lively discussion. And to our audience, thank you so much for supporting United Way. We wouldn't be able to do and continue the work without you. Thank you for tuning in. I am Gloria Pace King, and I will see you next time.